COVID-19 cases have surged in Louisville.
WDRB's Lexi Ratterman shares the worry from health officials. Lexi?
The numbers of COVID-19 cases in Louisville are quite staggering as cases increase across the country. The week before Christmas, Louisville saw around 2,100 cases. The next week, the week of Christmas, that went up to 3,200 cases, so a steady increase. But January 1st, that week, the city was up to nearly 10,200 cases for the week.
Just over a year ago, we were deeply troubled when we reported over 4,000 cases of the virus in a week. Well, today we're looking at 10,000 cases of the virus in a week. So obviously a huge increase.
Louisville's health department fully expects the numbers to keep climbing. Most of the cases are the Omicron variant, which early signs show has less severe symptoms than other variants. While breakthrough cases from people who are vaccinated are rising quickly too, officials say the vast majority of people in the hospital battling COVID-19 or dying from the virus are unvaccinated. Health experts now worry the spike in cases might overload hospitals.
At this rate, it's very likely that our hospitals are going to be in crisis mode, so beyond capacity very soon, meaning critical and elective surgeries may have to be postponed. And if you have COVID or a non-COVID emergency, it might result in delayed care.
The health department reminds people of the updated quarantine guidelines. Take a look here. 10 days if you're positive with symptoms, that's your quarantine. You can end isolation at 5 days if your symptoms resolve. And they say you should quarantine for 5 days if you test positive with no symptoms. As for long wait times to get a test, the health department says you should be waiting between 4 and 5 days after your exposure to get a test. They say that should give you plenty of time to make an appointment. And during that time frame, officials say you should stay home until you can get the test. Lexi Ratterman, WDRB News.